Hey everyone, welcome back to the channel that turns complex medical science into easy, fascinating knowledge. Today we're diving into one of the most exciting breakthroughs in medicine, using CAR T-cell therapy, not just for cancer anymore, but for treating autoimmune diseases. Before we begin, this video is for education and inspiration only. It's not medical advice. Be sure to consult a healthcare professional and double-check information with trusted sources. Let's explore how it works, why it's such a big deal, and what the future could look like. So first, what is CAR T-cell therapy? CAR stands for chimeric antigen receptor. In this treatment, doctors take a patient's own T-cells, those are special immune cells that fight infections, and genetically modify them. They add a new receptor to help the T-cells recognize and attack specific targets, like cancer cells. Then they multiply these supercharged T-cells in a lab and infuse them back into the patient. In cancer, this therapy has already saved lives, but now researchers are seeing amazing results using it for autoimmune diseases too. Autoimmune diseases happen when the body's immune system, designed to protect you, gets confused. Instead of attacking infections, it starts attacking your own tissues, like your joints, your skin, your nerves, or your organs. Millions of people live with these conditions, sometimes dealing with serious pain, disability, or even organ damage. Current treatments often involve medications that turn down the immune system, like steroids or biologics, but these don't cure the disease, and they come with side effects. Here's the exciting part. Scientists found that CAR T-cells could reboot the immune system. Instead of fighting cancer, the engineered T-cells target and remove the malfunctioning immune cells that are causing the autoimmune attack. Think of it like pressing a reset button on your immune system. In early clinical trials, patients with severe autoimmune diseases who had not responded to any treatments, some even facing organ failure, saw their diseases go into remission after a single CAR T-cell therapy. At prestigious centers like the University of Pennsylvania and in Europe, small but powerful studies have shown that CAR T-cell therapy helped patients with lupus, myositis, scleroderma, and systemic sclerosis. And more studies are being launched for conditions like multiple sclerosis and rheumatoid arthritis. Some patients became symptom-free for months, without needing daily immune-suppressing drugs anymore. But like all powerful treatments, CAR T-cell therapy isn't without risks. Because it boosts immune activity in a big way, patients can develop a reaction called cytokine release syndrome, basically a dangerous level of inflammation in the body. Doctors are really good at spotting and treating these reactions early, but patients still need to be monitored closely in a hospital for a few weeks after treatment. Also, it's expensive, right now costing several $100,000 per treatment, and more research is needed to know how long the benefits last. Researchers are working on making CAR T-cell therapy safer, faster, and cheaper. They're even designing new kinds of CAR T-cells that can be made from donors, not just the patient's own cells, so more people can get treated quickly. Imagine a future where diseases like lupus, multiple sclerosis, and rheumatoid arthritis can be controlled or even cured with just 1 or 2 treatments. That future might not be as far away as you think. Thanks for joining us on this exciting journey into the future of medicine. If you enjoyed this video, hit that like button, subscribe for more fascinating science updates, and share it with someone who might find it inspiring. And remember, knowledge is powerful, and the future is full of hope.